Happy fall, everyone. Welcome to the Health Equity Workgroup Monthly Meeting for October. Today, October being the 17th of the month. Again, if you are joining us for the very first time, we say thank you and we welcome you. We do invite you to put your name in the chat as well as your organization that you are affiliated with. You are also welcome at this time to verbally state your name as well. Do we have anyone new with us? And it looks like our icebreaker for today, Taylor, is what is one self-care practice you enjoy during the fall? Self-care is so important. Ooh, pumpkin spice donut holes. How fun.
Do you have any specific location you would recommend getting those? I'm partial to apple cider donut holes, but pumpkin spice will work.
Where do you get your apple cider donut holes from?
This season, I have done absolutely nothing fall like this season. I actually had a concussion 2 weeks ago, so right at the beginning of that fall season, so I haven't done anything. So that's why I'm curious where people have gone.
I hope you're feeling better. How are you doing?
I am. Thank you. Is anybody else having any audio problems? Can you all hear myself? Is there Cesar?
Oh, we're good now. We found the problem.
Okay, great.
Okay.
It was user error as usual.
It
I
happens
think the
to us
question
all.
was, where do you get your pumpkin spice donut holes from?
Well, I was wandering through doing a midnight run at Safeway last night, and there they were staring at me. So I was like, okay, in the cart you go.
Here I am thinking there's like some special farm in Prince George's County that we can all.
I'm sure
That's where
are,
I was going when I was asking.
I'm sure there are like far superior pumpkin donut holes wandering around out there, but we just went with the run-of-the-mill Safeway.
Got it.
We'll do a follow-up next meeting and we'll hear everyone's check-in about finding donut holes and where we can recommend.
Ray, your house must smell so warming. I see you have candles all over your house. That's wonderful.
How I get some of the pumpkin spice in and the apple cider in the fall mornings. If you go to Bath and Body Works, they have a fall mornings or fall walk scent that's new. It smells so good. So yes, I feel like I'm like in a whole wonderland here.
And Judy, which pumpkin patch? Do you have a specific one that you like to go to?
I like to go to Lairland. It's up off the 70, and they have the most amazing apple fritters.
Yes. I have heard of them.
In fact, I think I like the apple fritters more than I like picking the pumpkin, to be honest.
Yes, driving to see the beautiful foliage. Yep. Yep. As I just mentioned, I just came from Denver on Tuesday, and it is beautiful, absolutely beautiful. Of course, it's supposed to snow by the end of this month there, but it was nice to see how their leaves are changing out there.
And I know, Dr. Powell, is this your first meeting joining us?
Yes, it is. Hi. Hello. Thank you. I apologize for not being on camera. I'm actually sort of doing two things, but I'm sort of at a meeting also downtown DC that came about before this one, but I didn't want to miss this first meeting. So thank you for having me.
You're
welcome. Thank you for joining.
And Dr. Bauer, I know you have two new team members. They would like to introduce themselves.
We do. Yeah, Amanda, you want to go first?
Oh, okay. Hello, everybody. I'm Amanda. I just joined with Dr. Marlena here.
Hi, everyone. My name is Marlena Orantes, and I'm really enjoyed to be with you today. So, you just want to say a tiny bit about your background, just a sentence or two?
Sure. So previously, I am an ESOL teacher. I have some teaching experience and a lot of program planning experience. So I'm excited to hear your initiatives and bring maybe some of my experience to the table.
So, I have a little background in medicine, and also I have 14 years working with the University of Maryland Extension in the Food and Nutrition Education program called FNET. So now I enjoy and be so grateful to join with Dr. Bauer at this moment.
Yeah.
So they started a week ago Monday, so they're really brand new to us. We're very excited. We have one more person that we brought in who's not part of this particular work activity, but yeah, we're very excited to have this new crew at the Horowitz Center.
Awesome. Well, thank you so much for joining us and look forward to future meetings with you all.
Well, thank you all so much for sharing what you do to stay well in the fall. We can go to the next slide, Taylor. Thanks. So for our agenda today, we have the Health Equity Resource Inventory Review. Thank you so much, Ray, for being on with us to show us the new resource inventory that we'll have online. And then we'll go into some coalition and work group updates, community announcements, and then we'll adjourn for the afternoon. So at the beginning of every meeting, we just like to make sure that the vision stays at the forefront of everyone's mind as we move forward with a lot of the work that we do within this work group. So it's here that the Prince George's County is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender, gender identity, or health literacy skills. And Taylor, I'll turn it over to you to introduce Ray as she is introducing to us the resource inventory.
Thank you so much for that introduction, Zerzacer. Welcome, everyone. For those who I have not met yet, my name is Taylor Palmer, and I'm a health policy analyst here at the Prince George's County Health Department. And I am helping to manage our local health improvement coalition that includes this work group and 3 other work groups in working through the leading health priorities set out by the community health assessment. So today we are very fortunate to be joined by Ray Wallace. She is going to be walking us through her draft version of the Health Equity Champions Resource Inventory. So for our new members who are joining us today, this group has set out for some time now working on a health equity champions curriculum to educate and raise awareness surrounding health equity and health equity associated topics, and being able to empower community members to advocate for health equity and health and all policies, to county council, to the Board of Health. And so as an intermediary next step, the work group identified this resource inventory to be able to promote resources that the community could easily access at any time in their comfort of their own home or in any learning environment. And then using that resource inventory to then inform a future curriculum. So as I mentioned, Ray is going to share her screen here shortly to show us a draft of the resource inventory with all of the resources that the group has pulled. So thank you everyone for submitting all of the resources, all of your ideas, all of your feedback in order to make this draft possible. So as we're taking a look through that resource inventory, just a few questions to guide us. So of course, what resources are missing? We know that the landscape of these trainings is is always progressing. I know, for example, Christine is in a new training that she was just sharing about the other day. And so we just want to make sure that we are staying updated. And if there's anything that we need to add before the publication, the go live of this draft, please do communicate those resources. Again, thinking through what additions or deletions would make the resource inventory easier to access or view. Really glad that we have our Center for Health Literacy here today to look through and think through what would make this as user-friendly as possible. Again, as I mentioned, we're going to have community members, several different audiences who are going to be accessing this resource inventory. So we want to make sure it is as user-friendly and accessible as possible. And then next, again, as I mentioned, the process for what should our process look like for updating resources. We know that new content is coming out daily. We know that new practices are coming out. And we want to be sure that we have open channels for folks to be able to suggest new resources. So Ray will talk about that a little bit more, about how folks can go about that process for updating resources, adding resources as they come about. And then lastly, as we're thinking about our larger PGC Health Zone webpage, what other health equity initiatives or announcements should we add? Again, this is all generated by the community and for the community. So we want to make sure that you all have access to being able to share any fun announcements, any really cool announcements that you all have in advancing health equity. If there are any specific reports that we need to highlight, or any specific resources that we want to have beyond the resource inventory, if we want to highlight those on the PGC Health Zone webpage, we'll also have some open time for that as we, expand traffic, as we extend the resource inventory out to folks. We understand that the web page is going to get more traffic. And so again, we want to make sure that it is as up to date as possible and reflective of all the amazing work that you all are doing and all of the amazing health equity initiatives that are taking place in Prince George's County. So I will stop talking now and I will pass it over to Ray Wallace to share with us her draft.
Hi, everyone, and thank you both for the intro.
And Ray, you are muted.
Okay, I've hit the mute button like 4 times. Can you hear me now? Thank you. Thanks so much. So I was just saying, thank you for the intro. And then also that this is such a great idea and it's going to be a really awesome tool. So thank you all for letting me be part of the development. So I'm going to go ahead and share my screen and go off camera so I can direct my focus to where I'd like you all to see. So let me know if you all can see the screen that I'm sharing right now. Okay, great. And so, of course, it starts off with just the preview of what they're entering, how to engage with us, and then we start going right into the modules. And so each module, as you all originally shared with me, is broken up really wonderfully with the intro to the module and then vocabulary. So below for the vocabulary, just to try and keep everything pretty succinct, I've done a drop-down menu here. So each piece can be expanded as needed. Moving forward, we have the actual library of resources. So each library resource has its own description, and then, of course, the date that it was published. Each of these resources, as we add new ones and as they're submitted, you can even add an expiration date. So for example, if it's maybe a grant, we can always have that built in so these can roll off as needed. So basically, we can just hit on this first tool, which is a tool to normalize the conversation on why health equity matters. So it opens out into another screen and you have the option to view or download the document, and then you have the expanded description. When you click the view, it'll take you to the page where it originates. Could be a picture in some cases, it's a PDF depending on what the resource is. Now, one thing that I am working on behind the scenes at the moment is to remove all of this related content. It automatically displays in any resource library. So I'm working on getting that pulled off. So just in case you all are thinking the same thing as I am, that you want to make sure that people can see what is most important. So that is in the works right now. So going back to the main page, one thing I would like to do is add a picture before each module. And so as I'm going through this, if you all want to think if there are any themes that come to mind when you think of each of these different modules, let me know. I'll open it up at the end. So this continues the same way for the second module, where we're at quality health information. Same type of vocabulary with the drop-down menu, drop-down screen. And then it continues, of course, again to the second module. As you'll notice here too, you can also scan the different resources by the topic that it's related to. And so it's just a helpful mechanism for scanning the information to, make sure you're identifying what is going to be relevant to you. And then next, of course, same thing repeats. Now for the third module, we have 3 different resource libraries. After we finish with the vocabulary, as seen here as I'm expanding for you, we're getting into the 3 breakdowns. So we have a general resource library, and so this is this is general civic engagement resources. And then it breaks down into different advocacy resources, the advocacy resources for Prince George's County, and then of course the advocacy resources for the state of Maryland. And so these are separated out, of course, because that's, of course, we want to make sure it's as scannable and as easy as possible. So that is why we have these broken out the way that they are. And so that is generally, this is the full piece of what we have so far. Now, one thing that also came up too is editing these, and editing anything on your page, anything that you'd like to see on any of your pages. This is going to be a drop down underneath of your work group right here. And so if there's ever any updates that we need, if there's an update that needs to go to to any of the resource libraries, all you have to do is email the general PGHAC email. Now for the resource library, I'm going to come up with a really simple set of questions just to ensure that we're getting all of the information necessary for each of the resources, like the data publication, the link, just to break down the pieces of information that we'll need. But I'll pull that together and get it to Taylor. But again, just generally and specific to the resource library, if there are any changes that we would like to see, all you have to do is email that email, the pghac@copgnp.us. But you all know that. And so to turn it back over to you all, do you have any glaring ideas or thoughts on maybe themes that I can use to inspire an image under each of the modules, or is that even something that you all want to see?
I see.
A question from Dr. Powell.
Yes. Excellent. I love this. I think it's a great job, Ray. So I commend you for the work. I don't know the history of everything. I'm new to the group, but I would, and it may be there. I just need to look at it closely. But do we want a module, or is there any information there on cultural competence, or either diversity, or even definitions such as something simple as what's the difference or the definition of race versus ethnicity? And that may help with just some of the understanding social determinants of health, and sometimes how it gets categorized and how it gets grouped, and how statistics are done around that. But I love it. I think it's great. Excellent.
Thank you. Thank you. I love that note too.
And yeah, I
Dr. Powell.
believe so. I thought there was, or maybe I'm wrong. It's been so long since I looked at the source document. I thought we did have that base information. I know when we were talking about the larger, um, so Dr. Powell, just to give some background, this was like a first step before a larger curriculum, meant to be, um, leading to lay like residents and, other stakeholders learning more about health equity and, health and all policies. But I do believe we had some. Hmm.
We have
It's
some.
definitely,
Oh, go ahead too.
it's in there. It's just, I think it's buried in a source. And so it was more clear like when we were planning it. But what I can do is I'll call out those specific definitions, and I can have those highlighted in the vocabulary section.
Thank you. I wasn't sure, and this is my first look. So thank you, and I'm glad that it's there.
And yeah, thank you, Ray. I echo what Dr. Powell just mentioned. It looks great. Sharon was asking, and I had the same question. So the resource date that's listed, are that is that just the date that it was added to this list? Okay.
Yes, that was the. There are a few situations where maybe there was a law passed or a something very specific to a date where that date is shown, but for the majority of them, they are the date that they were entered. And so, like for example, I think there was like a press release maybe in one that had a date on that as well. So if I saw a date, I would add that in there, and that's also something that I can clarify on that little form I'll have folks do when we're doing the updates, if there is a pertinent date that they would like to see listed and or expiration date.
I see a hand from the Horowitz Center.
Hi, yeah, my question was actually about the health information module. I know that we've given a lot of feedback, so I was wondering sort of how did the module end up getting finalized? Did it get returned to the student team, or sort of what happened to it after all the feedback?
We narrowed it down from the feedback and tried to, again, differentiate between organizational and personal health literacy, and then really highlight the resources from the Horowitz Center so folks can take a look at the legislation that has been passed. But again, this is very much work in progress to see, how folks access these pages. This is something that a lot of folks are landing on. We'll be able to have that metric and then pay more close attention to additional resources that we want to add in this section and in the other modules as well.
So is this live on PGC Zone now, or is it on a development site?
Yes, it's in draft form at the moment. It's not published. It's not live.
Okay. So is there a way that we could, I mean, because we can kind of see it on the screen, but is there a way that, are we going to get a link that we can get a closer look after the meeting, or how could we follow up with one to take a closer look at the organization?
Sure. Well, once we lock in our first round of changes that I get from the groups and add in a couple of those sections like the pictures that I mentioned, what I can do is get a testing link together for before we go to a final publish. But I think I have one step before I'll be able to get you that that tester link.
Okay, great. Thank you.
Sure.
Yeah, Ray, I think for me personally, like that tester link will probably be really helpful in order to provide feedback. Because I have bad eyes. And so like for me, it is hard to see based on from your screen through Teams. Thank you. That is
No,
very
you're
helpful.
fine. I'm looking
Super
at
helpful.
a ginormous screen right now, so I totally understand.
Mm-hmm. So yeah. Because I think even some of the language that I saw at the top, we may want to edit. So, but I think it's hard to probably do that in a group like this. Unless are there other glaring things that you think we should talk through?
I like the idea of once I add in anything over the top that we notice on a firsthand basis, getting you all a testing link, and then we can come up with a way to get in any additional feedback.
Okay.
That way you can click through, I do want to try and remember, in the beginning, I mentioned that there is a related section that's longer than the actual resource. Once you click on it, I want to fix that on the back end with the developers. And I want to add in a couple just sections. And then from there, I'll request that testing link. And then we can come up with a way to fine tune the pieces that we have.
Okay. And yeah, even this like first block where it's kind of introducing the resource list, it seems to be focused more on the Health Equity Champions program first. And I just want to, maybe we can tweak that language. At least that's what I'm seeing. It seems like there's an opportunity to kind of shift it. So it's clear that this is not the Health Equity Champions program. But I do understand why that language is there.
Absolutely. And that's the reason for all of this. So we can make sure we have all of the pieces in the place that we want and that they make sense. Because sometimes seeing it on a document and then seeing it, on a page, it's two different experiences.
And I see Sharon's hand.
Yes, I see that these are annotated. So I guess my question is about building on and sustaining. How, if we're sending stuff into the generic link to be added, I assume that whoever is responsible for putting it in is going to want us to annotate it in some way so that they don't have to read everything that comes in. So I think that we need to be, so these curated lists are really helpful for anybody who's like wants to look things up or is doing some research. But I think we need to be very conscious and careful about curating and annotating what the reports are, so that we would put them in and hopefully somebody on the other end would review what was written about the document and make sure it was accurate and reflective of what the document is.
Yes, that would be me. So what happens is it goes to the PJGC email primarily, just in case there are any conversations you may have had with Taylor that I may not have been privy to. And then she'll share that document with me. All of the information that I'm going to request will be already listed out. So all you all would have to do is add in the information. As I'm going in and building out the list, I'm toggling between the information that you sent me and the links that were provided to ensure that it makes sense and that the descriptions that I'm creating for the resource are in alignment with what the viewer is going to see. So definitely, I'm that person.
Okay, I just wanted to make sure. It's a big job. So we appreciate it.
No, absolutely. And it's part of what happens with the website anyway, because we have several other lists, and that happens often as well. So I have to make sure that we're not, and sometimes we get spammed. That happens. So I have to make sure we're good.
So I guess a follow-up to that question is, this looks like it's a standalone list that can live in perpetuity if it needs to. Is there going to be another place where you would want time limited things? Because I can't imagine somebody going here to look for like a grant announcement or a webinar announcement or something. Is there going to be like a box or window that pops up with like current things if people want to post current things?
The good thing is that we can post current things because we have the mechanism to add an expiration date. So if we have a grant that is expiring in 6 months, I can add in the date that it expires on the resource. Another option we have is also the PGHAC calendar. So we can even have the resource linked to the calendar. So if it's a webinar that they're interested in seeing, they can click it, it goes to the calendar, and they can see, the full listing and, decide if they want to go to it or not, attend or not. And so we do have that option. And Taylor and I have chatted about cross-linking it to our calendar just to ensure that the two pieces can speak to each other and the information is available in multiple places. But we do have that option to put things that have expiration dates on them too. Absolutely.
Okay, thank you.
Of course, thank you.
And so if you are requesting for any updates, are those updates, are those requests only coming from work group members, from the public? And if it's from the public, is it different from utilizing that Contact Us tab that's on the bottom of the page?
So the Contact Us takes you right to me, actually. So when people respond from the public, and this is why I was mentioning this is something I already have to do. When I get a Contact Us from the website, I get an email, and that person might be asking to be added to the behavioral health provider list, or they might be asking to be contacted about measles or how to get in contact. So that comes to me, and then I have to respond or react. Now, if it comes through, we also have a calendar. And for the calendar, anyone also has the opportunity to add their own information to the calendar. There's a little button that they can press and they can add their own. That's that add their own event, which is right here. I also get an email every time anybody adds an event, and I have to review it and approve it. And so those are the two different ways on the website that I get contacted directly. If it's coming from within our work group, it's usually going to come from the PGHAC through via Taylor, or to me directly from someone who just is reaching out to me to, ask a question or something like that. But any type of update can go directly to PGHAC. And like I said, I'll give you all a little form that can be embedded in the email. So it's just really easy, like date, location, time, what it is, and so you don't have to think too much about the pieces you want to add to it.
Okay, thank you.
And there's a question in the comment in the chat. The audience is any Prince George's County resident or those working in the county who wants to learn about health equity and health in all policies within the county. This is meant to be a precursor to our Health Equity Champions training program. There it is.
And for those who've been involved in this, I just want to paraphrasing what I believe we've all discussed in the past, but is there anything else that you would add or adjust to that explanation of the audience? Okay. And also see how are we getting this resource out to this audience? And I know we briefly talked about this. Taylor, I'm trying to remember what some of the channels that we said that we could send this out through. I know certainly sharing it with county council member staff, department chair or agency or departments heads, so they could disseminate through their own departments. And I think this is a good opportunity for us to kind of think through what those additional dissemination channels could be.
Yes. That was going to be a reflection question for us all. Like you said, Christine, having the PGC Everyone, that goes to all Prince George's County government workers. And so to disseminate through their networks, for example, some of our agencies who work one-on-one, more so community facing, can get it to those folks. The Board of Health, County Council can get it to their constituents. We get many questions from community engagement folks and all of our different agencies here at the health department. So making sure that we get those links out to folks, and overall raising awareness as well about the work group for any community member who might be interested in joining the work group as well. Is the communication department involved in this dissemination process? Yes.
They would have to be, especially for the, for example, PGC Everyone, which goes completely throughout the entire Prince George's County government. We would have to work with our communication to get that approved for any marketing that goes through that channel to get approved.
Ray, do you happen to know whether or not communications has like a form? Well, they must, because I've seen it. I've seen posts from the county on like Nextdoor. It may only be like a portion of the county, but if we're also trying to get lay residents included, that may be one way. At least civically engaged people.
I love that. And I can always ask Delia what her options are for additional dissemination. Of course, the health department has their own social media accounts that can be really helpful, but they may have some faith-based organizations that might be helpful for us to get this out to as well. And then even within our own partners, like the Health and Wellness Department of Parks and Recreation, they do a lot of reach and outreach, not just within their own community, within their own staff. It'd be helpful for them to know about this resource, but it's also would be beneficial for those who they're working with. And there's a lot of interconnection between us anyway, the health department and Parks and Recreation's Health and Wellness Department. So yeah, there's a lot of opportunities. Absolutely. Maybe they can help us develop a communication plan. Absolutely. They can help us with a dissemination plan for sure. So we have our options. We can get our list together, and then I can reach out and see what other mechanisms they have for us.
We also have the other 3 work groups, like I mentioned before. We have our behavioral health folks. We have our community care coordination team. Those are many of our CHWs who are in the field. All of our federally qualified health centers. And then we have as well our healthy eating, active living work group. And so again, those are more partners who are very community facing, who will be able to get this resource out, have it linked on their pages, get it out in newsletters. So it's hopefully reaching as many community members as possible. And I see Sharon's hand.
There I am. So I'm sort of thinking about this in a little more systematic way and thinking about kind of longer term things. Does this website have the ability, can you pull out data on like the number of hits where they're, and usually I know in some platforms you can get the location of where the hit is coming from, you know, the geographic location. I think if we do, and I'm looking at Judy's comments, is it would probably be to our advantage to do a dissemination plan that's you know, documented and systematic, and then to be able to track hits and geographic locations or other data, so that we can see who we're hitting or who's responding and using the resource, and then looking at where there might be gaps so that then we can, you know, add on to any dissemination plan. I think information that we get back will be valuable as we go forward.
I agree with you. And so does Taylor, because we just did a training on, all, well, not a training. I went through and shared with her all of the different analytics that we get and how it can be useful. And so I think that'll be great to help us achieve the benchmarks that we're looking for. And even to see, oh my goodness, like this is where we're starting from and this is where we're growing. And even to be able to fine tune the resource library on what's popular and what people are clicking. Because so I'm right there with you. I got excited when you said that.
Yeah, I think it's a wonderful opportunity to learn more, especially as we're considering kind of health literacy across the county and across government agencies and stuff. How are people responding? Are they using this material, or are we talking to ourselves? And what can we do to broaden our reach if we are talking to ourselves?
Yeah, I love that, Sharon. And to piggyback, to expand on that, I think what's missing. So, I mean, I think if we are also, like, as we're using this as the first step to that Health Equity Champions curriculum, finding out where are some of the other information gaps that we can help, either it's information or skill gaps. So I don't know if there's an opportunity to include a survey, um, like going past analytics, um, if there's a way to passively collect feedback on what else would you like to see? What would be helpful to you? I don't know what those questions are, but things of that nature, I think can help inform or validate what we've already kind of identified for the Health Equity Champions curriculum.
I like that, like an additional like feedback form that could be at the end of the resource library. And that'll be also an opportunity for us to funnel more information in that maybe we wouldn't have been privy to. So yeah, I like that.
So, I mean, even like, would this be of value to you? What kind of format? Something live? I don't know how deep we want to get, but I think some of the things that we've struggled with were what formats would work for um, people who don't do this every day. What's interesting? Like, what works for you? Daytime, evening, like asynchronous, live. I mean, maybe that's too much, but maybe it's like, hey, I would be interested in something like this. I can be contacted for further follow-up. I mean, I guess there are lots of opportunities once we have a resource out there and we have people interacting. I think it's just how are we using it, and then also who's using the data. I hate asking for data and we don't use it. That's the other thing. Don't want it to get lost anywhere.
I'm just checking in on the chat.
And yeah, that would be great. So like have this, so this could be the group that goes through it and it's not just one person's responsibility. That could be in terms of sustainability, because people change, things change. We had Kim here 3 months ago and she's not here. So there's always changes. So I always think that's something, sustainability and succession planning and who's going to own something. But if it's the entire group that owns and we periodically come back and look at the data quarterly, I think that's a great idea.
It would definitely be helpful for our work plan, and we could detail out some of those matrices that we want to include and make sure that we're tracking, and we can have that accessible as well to the community so they know what we're working on and prioritizing. And of course, we'll be tapping on the shoulders of some of your organizations who have implemented curriculums in the past. So, for example, I'm just looking at IPHI, thinking through like what would they wanted to know before they held a training, or what are some of those lessons learned that we can draw on and include in a hopefully an evidence-based voluntary survey. And Judy, I'm seeing your comments about Find Help and our integration there. So let me know if this responds. So we're moving forward in another one of our work groups, the Community Care Coordination Team. We are investing in Find Help, which is a community resource inventory for community-based organizations, for practitioners, providers, to include their resources, their programs that they offer. And so Find Help will integrate into the PGC Health Zone website. We currently have, for behavioral health providers, we have a provider list that is being taken down and will be updated with Find Help instead. So Judy, to your point, Find Help will be accessible through PGC Health Zone, but it's not going to be adjacent with the resource list that we have here, but we could always have some sort of call out button that says, need direct care resources in Prince George's County, click here, and that would direct folks to Find Help. Does that address your comment? Okay.
Sorry, I'm in a car with other people's traveling back from a conference, and so that's why I'm typing instead of talking. So I apologize. I just don't want to disturb them or you guys.
Appreciate you being here, Judy. So yes, I will keep the group updated if that's something that everyone else is interested in with Find Help. That's something, again, that our CCCT is working on. And I apologize if I confused everyone with that additional context there.
Well, me too. I think I started the confusion.
But I think that Judy goes to a good point, which is, when I have to direct somebody, when I'm directing somebody to the PGHAC website, it's kind of buried in the Health Zone website. And I don't know if there's a way to make this a little bit more outstanding, because it's a pain. If you don't know exactly what to go and what you're looking for, you can't find it. And so, or you have to really dig for it. And I think that, a lot of people will stop digging after they go. If they go to the PG Health Zone and it's not clear what this is or where it is, they stop at that point.
Are you referring to data or the behavioral health list?
No, I'm talking about the Prince George's County Healthcare Action Coalition web part of the website in general. It's not apparent. It's not readily or easily apparent. If somebody's not already engaged in some way with this organization or with the processes, or doesn't really know how the county posts its resources, I think it's very hard for people to find this. That's just been my experience, especially if somebody's like quickly looking around for some resources.
Specifically. Yes, I understand. Okay, I got you. Absolutely. And I have to revisit the Prince George's County Health Department website. They recently went through a big redesign, and a lot of the interconnectedness got lost. So I'm going to go back and revisit, and just to make sure at least we're present somewhere on there, because I agree with you 100%. To find where we exist as a whole, unless you coming from some part of the circle, is difficult. So thank you for that. I'll revisit.
Thank you. I appreciate that. I just, I hate to direct people to things and then have them correct me and say, I have no idea where this is. And I have to really step by step walk them through.
Me too.
Okay, now I see what you're saying, Sharon, because I was like, oh, in PG Health Zone, it's right there. But if you're not part of the inner circle, PG Health Zone doesn't even enter into your lexicon. I get it. Yeah.
I get it too. Yeah, I'll work on getting that back up. I went through a round 1 with them, but let me do a phase 2 just to make sure that not only is there a link back, but there is some sort of explanation and description of what we are and what we do.
And I hate to say this, but I never used the county's health department website because it used to be useless. So
it's hard
perhaps now that it's redone, I should go and look at the county's health department website.
Well, I'll give you a heads up once we finish our part, so you can make sure that the linking is working together, and it's we're in the same
Same boat there.
Thank you.
And I know you all have quite a couple more things to get through today. I know I kind of took up a bit. Taylor, is there any other piece that we want to go through with the website?
We appreciate it so much, Ray. So I'm just going to do a quick summary of our next steps. So Ray, you're going to work on generating some sort of testing link so folks can go through the content, take a look at some of the language that's used, make their recommendations for, again, creating that most final version of a draft.
Yes.
And then following up with Conduit about all of the additional information that we have on the back end of things, and then thinking through what would a form for submitting resources look like. So in a future work group meeting, if that's something we want to start tackling, to start discussing, what would that look like when folks are submitting resources? What do you need, Ray, for in terms of the annotation, as well as the link and any expiration date? And then going deeper into tracking success, what does that look like? So again, I put in the chat the matrices that the website currently tracks, but taking that a step further and maybe looking at some content evaluation, how folks are utilizing this information. And then, of course, what would a curriculum look like? What would they want to desire for that? And then creating some sort of quarterly review process internally for the work group.
Yes.
Hopefully that was a good summary of what we discussed today. Any other points that folks want to say before Ray hops off?
All were a joy. I'm so glad to see you all and to get you the next phase of this. This has been a lot of fun to work on. So take care, everyone, and I'll be talking to you all soon.
That's great. Thank you so much, Ray.
It was great to see this like in the flesh, something actually jumping off of a Word document and into something that can be shared widely.
Favorite part of my job is the favorite part of my job. Well, take care, and I thank you all for that.
Thank you, Ray.
Thank you. One other, if Taylor, and I know this isn't in our agenda necessarily, but I think it is related. And I've shared with just a few of you. So Parks and the planning department, they specifically have a planning academy, a neighborhood planning academy. I actually I was selected to be part of it because I am also interested in planning. And it seems very similar in terms of the purpose to our Health Equity Champions program. So I just want to share that there is something else in the county that is very similar. The goal is to get residents, their elected official staff members that are part of this, to learn more about the planning process, so they are able to show up and do more. And the goal is to get more involvement in the planning process. So it's my hope that our Health Equity Champions program ends up being very similar to that. So one of the things I have for homework is to learn more about their structure, funding, implementation, things of that nature. Right now, it seems it's all government run and facilitated, which I know bodes other challenges, but I think just knowing that there is something parallel in the county is good. And I'll do some connection and bring back some feedback in terms of what they've seen in terms of success so far. I think they've already done 3 of these. That's it. I just wanted to share.
Thanks, Christine. Definitely look forward to hearing how you progress through that training. And something else I wanted to bring attention to as we're thinking through PGC Health Zone, and something that Ray brought up, all of these announcements that we have here on the site, these are completely can be nominated by the community. So if you have any articles that you want to link, any announcements, like I said, any interesting health equity work that is happening, if we want to link to the academy, if they have any sort of landing page that folks can access, certainly want to make sure that we are connecting folks and that this can become a place where we are sharing that information and being a hopefully a megaphone for all of our community partners. So if you all have anything that you would like to have featured on PGC Health Zone, as you can see, it's pretty outdated, some of our information here. Please do send it to the PGHAC email address that I put in the chat.
And Taylor, there's an option somewhere, right, for community members to be able to add their own events to the calendar. I can never find the calendar. Can you share where that's located?
Yes.
Maybe that should be more prominent somewhere.
Yes. I actually have a link I can include as well to adding your events to the calendar as well.
Yeah, I probably should have shared that or thought of that while Ray was still on, because I think that's, if you can't find the calendar, you're not going to use the calendar.
Yes.
And I think the next thing we wanted to talk through is just the coalition work group updates, or did you still? Okay, got it.
Yes, here it is. And I will send everyone this link, but essentially what you can do is you can just click add link here, add event, and you will be prompted to sign in and then to add any event to our calendar.
So where is the calendar if you just want to look at it?
It is.
That's what I'm saying.
Yeah,
it's hard to find.
Excuse me. Yeah, I have the thing bookmarked on my computer myself, so it is. Yeah, but I will bring that up.
I don't want to take you off time. It's just
so here it is under our Healthcare Action Coalition. Here it is, the GHAC calendar of events. But yeah, I will see if Ray has a way that we can highlight this, or at least have it on every single page, you know, as a button that folks can click and have direct access to as well. I will put that link in. I don't know. I don't think Zerzacer is back just yet. So I am going to run through a few community announcements right before she returns back. All right, so coming from the Maryland Commission on Public Health, there is an active survey on public health communications in the state of Maryland. We received a request from one of our coalition partners to share it out with the coalition and any of your networks. Again, getting this in the hand of as many Maryland residents as possible. The deadline for the survey is October 31st, and I will include the link in the chat for folks to access. And again, the ask is to please share this with your networks to get it out to as many folks as possible to have their voices heard. Next, the Maryland Department of Health released the 2022-2023 Children's Oral Health Screening Report. I will also include this link in the chat. I know that in the past, this work group has been aligned with some of the work that is happening at the state level regarding oral health. So the report has some information about specific disparities and some specific next steps at the state level that I thought you may all enjoy reading about and hearing more about as they progress, and there are opportunities to get involved some more. Next, coming from the Prince George's County Board of Health, Last Tuesday, there was a panel discussion on the health impacts of domestic violence. I will include that recording link here in the chat and in the meeting notes as well. We had a few wonderful speakers, one of which coming from the University of Maryland, Dr. Aparicio, joined to discuss the current landscape of the public health issue that is domestic violence in Prince George's County and some next steps that the Board of Health can take in tandem with the community-based organizations, our local hospital partners, and community members as well. So I will include that link in the chat for those who are interested in viewing and hearing more about next steps and some opportunities to again get involved and hearing more about the Board of Health and their commitment to addressing domestic violence here in Prince George's County. Next, coming up actually tomorrow, Friday, October 18th from 8:30 to 3 p.m. at the Maryland Innovation Center is the Communities in Action Advancing Health Equity Through Systems Change Annual Summit. So any folks who are interested, again, I will include that link in the chat as well as that QR code if you are interested in hearing more about initiatives that are happening around the state. This came from our partners over at Community Engagement Consulting Group. They've been active in the coalition and wanted everyone to know of this opportunity to discuss and collaborate with partners from across the state about health equity and related topics. Next, an observation of Health Literacy Month. Our friends over at the Community Engagement Consulting Group also sent out their health literacy newsletter, and I will be sure to include that in our meeting notes as well. So I am going to put all those links in the chat here, but do folks have any other community announcements or any upcoming events?
Excuse me. Yes, if anybody is hiring community health workers, my organization is having a community health worker job fair next Friday at the Community Action Group in DC. Taylor, I can send you the information for it late if to go out later, or if you're interested, you all can reach out to me, or actually, I can put my colleague's email address in the chat. But it is free to sign up for employees.
All right, any other community announcements? I will jump into this quick coalition update. As you all know, we have gone through this rebranding process for the last month or so. So we want to first thank you all for voting on the new coalition name. So reminder, we were previously the Prince George's Healthcare Action Coalition, and our partners have voted to rename the coalition the Prince George's County Health Action Coalition. So we hope that this new name is representative in dropping that name, that care from the name, that folks can see themselves as a larger piece in health and all of its associated topics. So we hope that everyone is proud of the name and all of the work that goes on within the coalition. And again, we thank you all for all of your support, everything that you've done to assist the coalition. And Ray will be in contact with us all about next steps regarding the logo. We'll be refreshing the logo. This is our current logo here. We'll be adding the new name and making some small revisements, and then that will go out to all of our partners who use our logo in any of their reports or in any of their websites. And we will revisit a larger new logo sometime in the future, but just to get us through with the new name, we will have that new logo to represent it. All right. And I don't know, Sir, are you back with us?
I am back trying to catch my breath.
Perfect timing.
Okay, sorry, I was just picking the little one up from school. But this section here is going to be a little bittersweet. So, um, starting November 1, I will be transitioning from my role as co-chair of this outstanding and phenomenal work group, to which my hope I'll still be engaged as a member. I just have a few new exciting plans approaching in the health equity space and in medical education, of which I'm involved in professionally for my work. And then, of course, some things personally. So with that, comes some competing priorities. But just in kind of assessing all of that, just, how I can really be fulfilling in all of those areas. So I've also moved to Baltimore County. So I definitely like to, be more involved in the community I live in as well. Um, so that's a little bit of my news. But as I was thinking about my transition, Dr. Sharon Gibbs Cooper absolutely came to mind because she's been super consistent. Her presence has been consistent, and her attitudes towards health equity and the purpose of this work group has been outstanding. And we are very excited that she has graciously accepted this role. And so Christine and Taylor and I, we are very, very, very excited for her continued involvement with this work group. Um, I think I remember beginning in 2017. I met a lot of wonderful individuals within this work group. Some are still here, like hi Sharon. Others have moved on, but I don't want to miss anyone out. I'm not sure if Anya is on the call, but Anya has also been superb as much as I've known her in her role um, within the Health Equity Work Group. But I just want to definitely acknowledge Christine and Taylor and just say thank you. You all have been such a pleasure to work with in all of our internal meetings and our work group meetings. And so I just want to say, thank you again to everyone.
And as your co-chair, Stacey, thank you so much for being that other person there to work through moving this work group and the work of the work group ahead, for your ideas, your passion, your interest. You know, hopefully we understand if you can't focus on us and come back because you are moving. If you've moved, that means that makes sense. So we've lost somebody else to Baltimore very recently. So we know that Baltimore has some wonderful new residents, yourself and Kim. So we do thank you for your leadership over the last, was it 2 years, and your
Yes,
participation in the work group in general. So thank you so much, Zersacer.
you're welcome. Thank you, everyone.
And I'm going to take all of your sentiments and throw them right back at you, Zerzacer. It has been an absolute pleasure working with you for the last year and a half. I thank you for always putting the Health Equity Work Group first. I know you have so many competing priorities, but you've given it really your all, and you've advanced so much, and all of your ideas that you've had have been so beneficial to the work group. And again, we thank you for your commitment and for also always helping to make this a welcoming environment that welcomed new members and energized them to be as passionate of health equity as you are. So thank you so very much. Looking forward to all that you will continue to accomplish. I think I need to move to Baltimore now as well.
Oh, you don't?
No, Prince George's still needs wonderful and excellent leaders like you. So
well, thank you again so much, Zerzacer. We look forward to staying in good contact with you, and we look forward to moving the work forward, moving your great work forward with Dr. Gibbs Cooper as well.
And I would just like to say thank you, Caesar and Christine and Taylor, for your consideration. I have huge shoes to fill. Your leadership, your commitment and dedication have been just role models and empowering and aspiring for us who all serve here. So your energy will definitely be missed. But as you said, the condition is you're going to pop in and out when you are available. So I'm going to lean on you heavily as a resource. So I look forward to continuing working with everyone. And thank you all again for this opportunity for being able to help advance in equity and build and bring contributions that will help inform initiatives that better improve equity in the county and throughout the state. So thank you again. And you will be missed. You almost made me cry. Just but thank you once again. And I look forward to keeping in touch.
And yeah, so I mean, and that's a good transition because I also want to thank you, Dr. Sharon Gibbs Cooper, for accepting the co-chair role. I mean, for several, your full bio is up here, which is a lot. I am not going to read it all, but several of you, if you participated in some of our previous meetings, saw that Dr. Gibbs Cooper was able to it was part of the University of Maryland Institute for Government Services and Research and did a presentation about the services in that her organization, and what it does for the region. Other things that our new co-chair is known for. She's worked in public service and public health realms, encompassing advancing social justice and health equity, integrating transformative, intentional, effective, and impactful strategies through community engagement, and then serves on a multitude of University of Maryland system committees, such as the Division of Research, Justice, Diversity, Equity, Inclusion Committee, University of Maryland's Medical System Community Advisory Board for the Laurel Medical Center, University of Maryland's Center for Health Equity Community Advisory Board, and Congressman Glenn Ivey's Reentry Advisory Board. So I think I look forward to benefiting from the wealth of experience that you bring to the table. And I hope, I think every time we have a change, there's new blood, and I look forward to seeing where you lead us and working with you. So thank you. And I think with that, our next meeting is on Thursday, November 21st at 3 p.m. There is a in-person quarterly meeting that's December 12th at 6 p.m. And registration will go out later for that, the in-person quarterly. Make sure you register so you can select your food.
Yes, and I put December 12th, but it's actually December 10th. So,
all right.
But I will follow up with folks with that registration information. But please put this hold on your calendar to celebrate the holidays and all of the success that all of our work groups have.
Thank you so much. I think we already did announcements, so we are done like 13 minutes early. Thank you, Sir Sacer, again.
Thank you,
I do
everyone.
hope to see you